So caring for children with cystic fibrosis is mostly about trying to keep them as healthy as possible. Parents can ask for their CF nurse or local team to contact school and meet with key staff such as special educational needs coordinators, teachers, teaching assistants, with a view to providing a brief overview of what cystic fibrosis means, but also what that means for their child on an individual basis. These are the people that are the eyes and ears around their child all day, and communication is key. Where possible, we would expect children with cystic fibrosis to do the same as their peers. We would expect them to go outside and play and pretty much do the same things as their classmates do. Soil and water may be an area of concern because of the bacteria that it may carry. So if children are going to play in these areas, staff should ensure that their hands and nails are thoroughly washed afterwards in soapy water, but would always suggest that parents are aware that these areas are areas that their child may be playing in. So other activities that children may need to avoid include hay, straw and rotting vegetation, as these can contain fungal spores that may cause irritation or discomfort to a child who has cystic fibrosis. So for example, if Arthur was to attend a school trip to a farm, it may be that if he was in the vicinity where they were clearing out a stable or a pen and there was loose hay and straw, that would not be an ideal environment for him to be in. Many parents ask us if their child should attend school when there are other childhood illnesses and coughs and colds going around at school. And we know that it would be near on impossible to prevent children coming into contact with other children who have coughs and colds and childhood illnesses. So our advice would be really ultimately parent decision. However, school can be and should be mindful that the child who has cystic fibrosis would not ideally be sitting next to somebody who has a streaming nose or a hacking cough, and teaching about good hygiene and maintaining good hand hygiene is imperative. Children with cystic fibrosis are usually pancreatic insufficient, which means that their pancreas does not work normally, and for this reason children need to take a food supplement called Creon. This helps them to absorb and digest their food better and is needed with any fat-containing food, drink or snack. We as a team can help support school in understanding how to dose the Creon correctly and to administer it safely and timely in accordance with when the child is eating food. We would also suggest that school are guided by parents as to when doses of Creon need to be increased, because the family are in constant contact with a CF dietitian, and the Creon dose will need to be increased as the child grows older and gets bigger and portion sizes increase. It's really important for children with CF, especially in the hot summer months, to ensure that they have access to water bottles during the school day and to ensure that they have plenty of fluids, as well as considering their dietary intake, including salty snacks. Children rarely need to have physiotherapy in school. Usually, with careful planning, physiotherapy is something that can be organised outside of the school day before they come to school and after school. It's not anticipated that children with cystic fibrosis will need to have lots of time off school. However, most children do need to attend appointments on a 2-monthly basis, and appointments can range from 1 to a few hours depending on location of their clinic. Additionally, children need to attend their tertiary centre, their specialist centre, usually once a year for their annual assessment, and that can take usually a whole day. Also, some children will need to be admitted to hospital for intravenous antibiotics, and that can be for a period of up to 2 weeks. However, some children do have home IVs, so can still attend school during this time. And also some hospitals have schools, which means that their children can be marked as educated off-site. So it's really important that schools consider this, especially when allocating things like 100% attendance certificates. Children with cystic fibrosis are kept segregated from each other to try to reduce the risk of cross-infection. So within a school environment, it is possible to have more than one child at school who has cystic fibrosis. However, communication is paramount because children with cystic fibrosis should never be in the same room as each other. We would encourage children from an early age to be open about their condition, and as parents and school and professionals, we can help support them in that respect. I think that if children are equipped, that if another child was to ask them, why do you have tablets before you have something to eat? If the child is supported to answer that with a frank answer, such as I need to have it to help me digest my food, then the other child is likely to be quite bored with the answer and move on to something, you know, far more interesting than worrying about why that child's having tablets. And it's out there in the open, and children, by understanding their condition, can help them, can better equip them to deal with questions in the future. We would advocate children with cystic fibrosis being fully inclusive, which would mean that we would very much want them to be able to participate in school trips, both day trips and residential trips, and would encourage parents to contact their local teams so that the nurses and physiotherapists can go into schools and support staff to feel competent and confident in managing a child who has cystic fibrosis for the duration of a school trip.
The meeting that we had with the cystic fibrosis team was incredibly useful. We met with Mr. and Mrs. Elliott and with Arthur's nurse specialist from